I'm Lucy. This is Shreya and Kavya.
Hi, nice to meet you guys.
Nice to meet
Nice to meet
you.
you too. Thank you so much for meeting with us.
Yes, thank you.
Of course. Yeah, no problem.
So you're studying oncology in University of Chicago?
Yeah, so I'm actually an internal medicine resident, and so kind of the path to oncology is that you do residency first in internal medicine, which is like broad general medicine, and then we apply to fellowship, kind of whatever we choose, and oncology is kind of one of those pathways. So right now in residency and applying in a couple months to oncology fellowship at
Oh,
U Chicago. Mhm.
okay. So we just had our few questions.
Yeah.
So our first question was, what inspired you to start your work in oncology or the study of it?
Yeah, sure. I mean, I think oncology is one of those fields that I think is growing and changing kind of like basically every day, but at least like every couple months, like in the year. And so I think that kind of evolution and like the change that's going on in the field is honestly pretty fascinating. And also, I feel like as new things are being found, the reach that it has on patients and the rest of like the population, I think is pretty growing. And it's also, I feel like one of the specialties that, especially being in internal medicine, where you kind of are a general internist and kind of take care of the entire body and like focus on all like body systems. Oncology is kind of one of those fields that's still like even as you specialize, kind of affects like all the organ systems, and you still have to like know a lot of general internal medicine. I feel like I really liked that about oncology.
That's good. We're studying, well, not studying, our campaign is based on skin cancer because that's pretty like that would be more prevalent in like Florida with the high
Mhm.
UV. One of our questions was, why do you think skin cancer awareness is so crucial right now?
Yeah, I mean, I think in general, I feel like the rates of like cancer and cancer diagnoses are just increasing across the board. I feel like especially for, I would say skin cancer in particular, I feel like especially in Florida, I think it's very prevalent, as you guys mentioned, just with like cumulative sun exposure. And um, I think a lot of younger people are like getting diagnosed at kind of a younger age. And so I think it's very important to kind of just like A, raise awareness that it can happen, and then B, kind of preventative measures as well. Because I feel like it's just something that's becoming more prevalent, I would say.
And then so for any listeners that may be listening that do not know exactly what the different types of
Mhm.
skin cancer are or the risks, what do you would you have happen to like know the different types?
Yeah, yeah. I think there's three main types. There's like basal cell, which is by far the most prevalent, though it's also, I think, the least aggressive of all of them. And squamous cell is the second most prevalent, and then melanoma is the least prevalent, but also the most aggressive and the one that metastasizes the most. I think the main difference between the three of them is where the skin cancer originates from and like what type of cell it originates from. Like basal cell obviously originates from like basal keratinocytes. Squamous cell is kind of more of the epithelial, and then the melanoma is like the actual like pigment cells basically that are um, causing the cancer. I think for all of them, risk factors wise, I mean, I think as most people know, cumulative sun exposure, like cumulative UV exposure. So I think that's the thing that sometimes is hard to understand is I feel like even if people were really young and like had a lot of sun exposure when they were like in their early childhood and teens and maybe kind of improve throughout life, they can still develop skin cancer kind of down the line because it's like a cumulative exposure. Also like UV lights from like tanning beds and stuff, which I think has become more mainstream now and people know that, but I think that's still super important. Smoking also does as well. And then people with just like fairer skin types are just more prone to like UV damage in general. And I feel like for a few of them, especially melanoma, there are certain like mutations that are genetic that sometimes predispose people to it. But I would say overarchingly, it's like cumulative sun exposure that is a big risk factor.
And then how has skin cancer treatment evolved over the past decade?
Yeah, I mean, I think each of them are treated a little bit differently, but I think the big thing that's been pretty cool, honestly, and across all cancers, but I think especially in skin cancer is like immunotherapy or targeted therapy has been like a huge thing in like the cancer world that's kind of blown up. And it's pretty awesome, especially for like melanomas, which are so metastatic, and melanoma can go to like your lungs, to your brain, to like a lot of different places. Immunotherapy is really nice because like certain markers on cells itself express certain genes or certain mutations, and immunotherapy can be targeted towards those. And it basically targets like the exact cancer cells that are growing that, and that can help like slow down the spread and slow down the progression of the disease. And so I think that's a big I feel like improvement in the last like several years in terms of all cancer therapy, but honestly, specifically like skin cancer as well, is targeted therapy.
What is immunotherapy?
Yeah, so immunotherapy or like targeted therapy is like there's certain mutations that are expressed on cells. So like things like BRAF or like other types of like cell marker expressions. And so there are certain therapies that are like either antibodies or like therapies directed towards like anti-BRAF or anti-VEGF, like against those specific markers. And so it's like a very targeted thing that can only be used if the cancer cells are expressing that marker. But if they are, then you're targeting like right there, basically on like what's helping like grow the cancer cells. So it's very useful if the cancer is expressing certain genes or certain markers.
Okay. And so then you talked about the risk factors and the different
Mhm.
types, but what are some warning signs that people could look out for when, like what they could look for on an everyday basis?
Yeah. Yeah, I think maybe people have heard of it, but kind of like the ABCDEs of like skin cancer is super important. So I think especially for people, as I mentioned, of like either fair skin, but even darker skinned individual, I think sometimes that could even be worse because I feel like we tend to not notice it as much in like our skin type. But looking especially in areas that you may not think is getting like a lot of sun exposure, like behind your ears, like a big one, or like on your like nail beds even sometimes, or like on your feet and like below your feet as well, like looking at places that aren't as common, and then like monitoring any like moles or like nevi that are basically growing in your skin. And then just looking at like those different qualities. So like, does it look like symmetrical or is it asymmetric? Like, does it look kind of like in a weird shape? What do the borders look like? Sometimes you can see like a really well circumscribed like little mole looks like a little circle, but if it's something more concerning, then it may be like a little bit more irregular or like jagged or the borders look a little weird. Colors too, I feel like most like benign moles are all like one like dark color. If you're worried about something like melanoma, then you can see like different colors or splotches like within the actual mole, how big it is, and then if it's growing. I think that's honestly the biggest thing is like monitoring those different skin things and seeing, is it growing? Is it changing shape? Are things like appearing and going away? That's like super important and like warrants getting checked out, I
Okay.
think.
Also, I was just want to ask, like, how fast does skin cancer like spread through the body?
That is a good question. It depends on the type. So like basal and squamous cell, much slower, honestly. It doesn't have as much of like a metastatic spread. Melanoma, depending on how aggressive it is, meaning like what type of markers or like what is the like genotype and phenotype of the melanoma, it can be a little bit faster. So it kind of depends on what type you have. Basal cell is kind of the one that looks like a little like pearly, like little growth kind of on your skin. And the squamous cell is kind of more like, it looks kind of like a little rash, honestly, like a little like patchy rash. And so those two are a little less quick spreading, I would say, but melanoma is definitely the one that spreads the fastest.
Okay.
Okay. And then our last question is, what are the most important steps that people should take in order to prevent skin cancer?
Yeah, I think the biggest one is wearing sunscreen with like good UV protection, at least like UV like 15 or 30 or above, and then also like reapplying it. I think appropriately too. I think sometimes a thing, especially like in Florida and stuff, if you're like going to the beach or something, like you put it on before you go to the beach, but then if you're going in the water and like it's kind of coming off and stuff, like reapplying it every like hour or so, I think is like really important, and applying it to all the areas as well, not just the ones that like are on your arms and legs, but like behind your ears, behind your neck, like on your feet. And then monitoring your skin, honestly, I think like being very aware of like the different like moles and stuff that's on your body and just making sure you're like, keeping like a mental track of it. And if it's starting to grow or change or look a little bit weird, then to get that checked out. And then just like normal healthy stuff, like not smoking and stuff like that, that like decreases like your immunity.
Okay.
Okay.
I think that was all of our questions. Thank you so much.
Yeah, thank
Yes,
you.
thank you.
And are you okay with this being uploaded for our campaign?
Yeah, that's totally fine.
Thank you so much.
Thank
Thank
No
you.
you.
problem. Thank you guys.
Have a good day.